What happens to your body when men over 50 masturbate regularly? Shocking science revealed. Did you know that a simple, private habit many men over 50 consider normal could dramatically affect your heart, prostate, and even your mental health? Could your natural routine be secretly harming or helping you in ways you've never imagined? Before we dive in, hit that like button, share this video, and subscribe, and leave a comment about your thoughts on this topic. Your insights could help other men too. Introduction: the hidden truth about masturbation after 50. If you're a man over 50, you probably assume masturbation is harmless, a natural, stress-relieving habit. But new studies from Harvard Medical School, the European Urology Journal, and the American Journal of Cardiology suggest the reality is far more complex. In fact, how often and how you engage in self-pleasure may dramatically influence your prostate health, cardiovascular system, sleep quality, and even your emotional well-being. One shocking discovery: Harvard's 30-year study of over 31,000 men found that those who ejaculated 21 or more times per month had a 31% lower risk of prostate cancer than those who only ejaculated 4-7 times per month. That's not a trivial difference. It's a revelation that could change how mature men view a habit they've been practicing for decades. Before we continue, don't forget to like, share, subscribe, and leave a comment about what surprised you most about men's health after 50. Your engagement helps spread this life-changing information. 1 month, immediate physical and hormonal impacts. Within the first few weeks of regular masturbation, your body experiences an immediate neurochemical cascade. 1. Hormonal shifts. Orgasms trigger a surge in oxytocin, endorphins, and dopamine while lowering cortisol, the stress hormone. A study in the American Journal of Cardiology indicates that this hormonal adjustment mimics light cardiovascular exercise, reducing blood pressure and offering a measurable heart protective effect. 2. Pelvic floor engagement. Urologists at the Cleveland Clinic highlight that rhythmic contractions during climax strengthen the pubococcygeus muscle, essential for urinary control. For men over 60, this can prevent incontinence, a condition affecting up to 25% of this age group. Unlike targeted Kegel exercises, natural contractions during orgasm engage the entire pelvic floor effectively. 3. Mental health boost. Research in the archives of sexual behavior confirms that regular sexual activity elevates mood and combats anxiety. For older men facing social isolation or the loss of a partner, masturbation provides a safe, private avenue to maintain emotional stability and self-worth. 4. Sleep improvement. Johns Hopkins sleep specialists report that prolactin released post-orgasm enhances sleep quality, promoting restorative REM cycles. For men whose sleep naturally declines with age, this effect can replace reliance on sleep medications that carry side effects. Practical example: John, a 62-year-old retiree, found that including masturbation in his weekly routine helped reduce nighttime insomnia and improved his mood during a stressful transition after retiring. 3 months, cardiovascular and prostate benefits. As masturbation becomes a regular practice. Prostate health. Harvard's research suggests that regular ejaculation flushes out carcinogenic debris from the prostate ducts, potentially lowering cancer risk. This cleansing is critical because, after 50, toxin buildup can accelerate abnormal cellular changes. Heart health. Repeated orgasms reduce arterial stiffness and lower heart strain. According to the Mayo Clinic, older men who might struggle with traditional cardio can achieve heart benefits similar to a 20-minute brisk walk through this natural activity. Pelvic and core strengthening. Consistent engagement strengthens pelvic muscles and core stability. Men report improved bladder control and even better sexual performance over time. Expert insight. Dr. Jennifer Ryder of Harvard emphasizes that this is not a set-it-and-forget-it benefit. The frequency and quality of the activity matter. 21+ ejaculations per month seem optimal, but excessive frequency can cause pelvic congestion or temporary reductions in sperm quality. 6 months, psychological and social implications. While physical benefits are impressive, psychological factors cannot be ignored. Emotional well-being. Regular masturbation releases dopamine and reduces anxiety, but relying exclusively on self-pleasure can lead to social withdrawal. Experts warn that older men who replace human intimacy with solo activity may experience loneliness or emotional isolation. Conditioning risks. Using the same technique repeatedly can condition the nervous system to respond only to that specific stimulus. Variation is key. Different techniques, pressures, and rhythms help maintain flexibility in sexual response. Cognitive benefits. Engaging imagination rather than pornography enhances brain connectivity and preserves dopamine sensitivity. Studies in JAMA psychiatry show that excessive porn use can reduce reward responsiveness and intimacy with partners, which is particularly detrimental for older men with natural cognitive decline. Practical example: Mark, 58, noticed that by incorporating mental visualization instead of frequent pornography, he maintained a more satisfying sex life with his partner while experiencing improved mood and cognitive clarity. 6-12 months, long-term risks and optimization. As habits persist beyond 6 months. 1. Overuse risks. Multiple daily sessions can lead to pelvic congestion, testicular discomfort, and temporary semen quality decline. Research suggests 2 to 3 times per week strikes the optimal balance for prostate and cardiovascular health. 2. Postural hazards. Many men engage in masturbation while hunched over phones or computers. Poor posture compresses the pudendal nerve, causing numbness, pain, or reduced genital sensation. Comfortable positions lying down with proper support are recommended. 3. Sexual health red flags. If a man can perform during self-stimulation but struggles with partner intimacy, it may signal cardiovascular issues, diabetes, or hormonal imbalances. The American Heart Association emphasizes that erectile dysfunction can be an early warning sign for life-threatening conditions. 4. Tissue care. Aggressive techniques or insufficient lubrication can create microtears, scarring, or infections like Peyronie disease. Water-based lubricants and gentle methods preserve tissue health. 5. Emotional impact. Cultural or religious guilt can negate benefits. Counseling or professional guidance from certified sexual health therapists can help mitigate shame and promote a healthier relationship with sexuality. Expert insight. Dr. Samuel Clark, a urologist with 25 years of experience, notes, "It's not just about frequency. Technique, posture, and emotional context dramatically influence long-term health outcomes for men over 50. Special considerations for men over 60. Cognitive preservation. Mental visualization instead of pornography supports long-term cognitive health by preserving natural dopamine pathways. Cardiovascular safety. Men with pre-existing heart conditions should discuss sexual activity intensity with their doctors. Prostate monitoring. Regular checkups and PSA testing remain crucial even with optimal ejaculation frequency. Shocking fact: a Harvard-led study shows that men who maintain a moderate ejaculation frequency into their 70s may enjoy improved longevity compared to peers who abstain completely. Conclusion: balancing health, pleasure, and safety. Masturbation after 50 is far from just a private habit, it's a multifaceted health tool when practiced thoughtfully. It reduces prostate cancer risk, provides cardiovascular benefits, strengthens pelvic floor muscles, improves mental health and sleep quality. However, overuse, reliance on pornography, poor technique, or emotional guilt can counteract these benefits. Moderation, proper technique, variation, and self-awareness are key. What shocked you most? Prostate cancer prevention, cardiovascular benefits, or the risks of poor technique? Leave your thoughts in the comments below. Hit like, share, and subscribe, and turn on notifications so you won't miss upcoming videos exploring men's health, vitality, and sexual well-being. Final takeaway: men over 50 have the power to optimize their sexual and overall health with informed, responsible practices. The science is clear: your choices matter. Take control today and invest in a longer, healthier, and more vibrant life.